I'm here today with Sarah Osborne. She is the expert doula, and she is here with all kinds of perspectives of baby loss, childbirth, pregnancy, all the things. So, welcome, Sarah. I'm so excited for you to be here with us today.
Yes. Thank you for having me.
Would you be willing to share your own story?
Yeah, absolutely. I've been married for 26 years. We started our family very young. I was pregnant as a senior in high school. We got married 2 weeks after I graduated from high school, had our baby, started our family. So 18 years old, starting a family, getting married, that was a lot, but it was great. I was happy. And then we kept adding, had another kid a few years later, and then we had another kid a few years later. So we have 3 kids. I never have experienced a miscarriage or any kind of loss at all, which I've been so fortunate to not have had to go through. I know that's very common. And as a doula, and of course, just as a person, I've had friends who've gone through that and a lot of clients that have gone through that over the years. So I've always recognized that and been very thankful that I didn't ever have to experience anything like that. Fast forward many years later, I was about 38, 39 years old, and my youngest was about 12. I remember the moment, the day I was in the bathtub and I was like, I think I need to have another baby. I want another baby. It was so crazy strong. I don't know if that was my maternal clock winding down. It was like, you're on your last moment to do this. But that feeling did not go away. I had not been like that prior. I knew we were done. I was okay with it
How
for
old did you say your
years,
youngest was at that time?
about 12.
Okay. Just getting out of the little kid stage into the
Yeah,
teenage, and you're like,
right.
wait a minute, I'm not
Yeah.
ready.
But I mean, my husband had had a vasectomy. Like we were done for a long time,
Right.
like years, and we were fine and we were happy and we were just going about our lives. And then I have this moment of, wait, I think I need another baby. I'm not done. And I pursued those feelings, really kind of made sure that they were accurate. And then I was like, oh my gosh, what is my husband going to think about this? So I brought it up to him and he was like, yeah, okay, I guess that's fine. So we went on this journey. We had a vasectomy reversal, and this was during COVID. So everything was shut down and everything was difficult and everything local to me. They weren't doing like any kind of elective procedures like that.
Mm-hmm.
So, but I was definitely feeling the crunch of time of like, okay, I'm only getting older. I don't want to wait another year. Like, I want to do this right now.
Yeah.
So we flew to a different state and had a vasectomy reversal. It was successful. And then I was like, great, now we can start trying. This is going to be good. And it didn't work in the end. We aren't really sure what happened. Either it could have scarred over or something happened. When we left the clinic, he had a really good sperm count, but then like 3, 4 months later, it went down to 0.
Oh, wow.
Yeah. And we were like, what
Oh,
happened? It was a huge blow and a shock because then I
yeah.
was like, are you reading the right chart? Like,
Yeah,
are you
because we've
sure?
already had 3 children.
So
Mm,
then our next best option was to do IVF because it just was, right? We could have
hmm
still tried the like do another reversal, but then you have to wait a year. And if that works, then you still have to try to get pregnant. And I'm like, I'm only getting older. That's like 2 years down the road.
Yeah.
So we decided to try IVF, and that was all out of pocket for us because that's not a covered expense with insurance for us. So that was a lot of money, really something that is so eye-opening. Like even being a doula, because I've been a doula for 17 years. So I've had a lot of clients have IVF and go through that
Mhm.
process. But until you actually do it yourself, you just have no idea. It is a
Yeah.
whole other world and it's really intense. A lot of emotions, a lot of hormones, of course, because they're giving you all these hormones too. Um,
hmm
so it's just a big focus, like a big kind of takes over your life for a while. We did that and that ended up being really difficult, which I didn't anticipate. I knew it might be hard, but I didn't anticipate having a struggle getting pregnant just because that had never been my story before. And so we ended up having to do 2 different egg retrievals. Basically, I was like, well, my husband's the problem because he's had a vasectomy, but I'll be fine. And like, I am fine, nothing's wrong, but I just was getting old and I barely was having any eggs. And so that was a problem that we just didn't anticipate. And so we went through 2 rounds of egg retrievals. Even at the end of the second one, they were like, I don't even know if this is going to work. You might have to consider embryo adoption or a donor egg. We finally got 4 eggs after 2 retrievals, which is not a
Wow.
lot. I will tell you, a
Yeah.
lot of times they're aiming for like 12 to 20 eggs. And so we got
Hmm.
4. We're like, okay, but it's worth a chance. Let's try.
Hmm.
So we got the 4. And the night before that, they did a procedure on my husband to extract his sperm. That's the only way they can get it is if they like go in and aspirate it out. And so they did that. They got my eggs, put them together, and we ended up having 3 eggs that fertilized normally out of the 4, which is good.
Great. Yeah.
And then out of those 3, we only had one that made it to day 5, which is like embryo stage. And we knew we were not going to go through this again. This had already been, we're like a year and a half into just IVF,
Mm.
probably like 2.5, 3 years into the whole overall, like, I want to have a baby to here. So it had been a
Yeah.
long time. And so we were like, this is it. We're done. We're old. We are out of money. This is
I
either
know.
going to work or it's
We gave it
not.
our best
We're not
shot.
going to
Yeah.
keep going. We knew that. We have kids. We can be
Yeah.
fine and content with what we have, but we would like this to work, of course. So I had to wait 2 weeks while they did genetic testing on this embryo, which was the worst 2 week wait. In my mind, it was like a yes or no. A lot of people who do IVF have many embryos and they're testing all of them. And so
Yeah.
their chances of like having 1 or 2 or 3 that are good are high if they're
Yeah.
testing like 5 to 10 embryos. But I only had one and I knew either was going to be like a go or a no go. That was hard to wait for because that was the decision on are we going to expand our family? Like, what is our future going to look like?
Mm.
Are we going to have a baby or are we not going to have a baby? That was a hard wait. And then we heard back. It was great news and like a perfect embryo and all the things. We found out it was a girl, and that was really
Mm.
exciting, which is still crazy to me that they can even tell that stuff like that early,
Amazing. Yeah.
it's wild.
Amazing.
So then we were preparing to detox my body from all the hormones and get it ready for implantation. The embryo was frozen, and it took a long time for my progesterone levels to get leveled out, 6 months to be exact.
Wow.
It was a
Yeah.
really long time of thinking, oh, we have this baby girl and we're going to implant her on this date. And then that date kept getting pushed out and pushed out and pushed out based off blood draws and stuff. So, like, that was really hard. And obviously, I'm a planner. I think a lot of us are. And
Mm.
I'm a doula, and that requires a lot of planning because I need to know in 6 to 9 months, like, am I going to be available for someone that wants to hire me now,
Sure.
So I kept having to push that date off, push the due date off, the due date off. And then finally it came and we were able to transfer her and it went super well. They were like, oh my gosh, everything looks perfect. The embryo is just ready to implant. They were like, she looks great. You look great. Everything's good. Now we just wait for 2 weeks, take a pregnancy test and call it
Yeah.
good, basically.
Yeah.
So when they do a transfer, they say you're pregnant until proven otherwise.
Okay.
And for whatever reason, she just didn't stick. And we have no idea why. Everything
Mm.
seemed good in the
Yeah.
transfer. I had the good symptoms of
Yeah.
cramping and all these implantation signs.
But when did you find out that she was not there?
We had to wait 2 weeks to
Mm.
do the blood work and
So
the
you felt
tests.
like, so you were optimistic, you had the
I was,
signs, you're like, okay,
yes,
pregnant until proven otherwise. And then,
right.
oh my gosh.
Yeah. I even had friends who had gone through IVF and they were like, these are really good signs, should be working.
Uh,
Because I had never had a loss, I wasn't worried it wouldn't work. My reproductive system has worked well. A lot of people who do IVF don't have that history. They're there because something isn't working. For me, it really should have been good odds. Yeah.
so how, yeah, so what, like, how did you tell your, because your kids are probably in, I mean, they were in on all of this, I'm sure.
They were to a point. We didn't tell them at the beginning, and they were old, like they were teenagers, all three.
Right.
Yeah. And we didn't tell them at the beginning. We just wanted to get pregnant and say, like, oh, guess what? We're having a baby. Because I didn't frankly want to hear all their opinions on it.
Yeah,
Um,
of course.
but then we had to tell them because going through this for years was
Mm.
really hard on me and they could
Draining,
tell.
so draining. I can't imagine doing teenagers and
Right.
that had to be
Yeah.
exhausting.
I have 2 boys and a girl. The boys were like, meh, like, okay, you guys are kind of crazy, but fine. And my daughter was upset. We had
Yeah.
to work through that and we did.
How are you still making peace with that was the last one? Or how did you know
Right.
that was,
I mean, we knew because
You couldn't do the whole
Right.
thing.
What other options are keep doing IVF or do embryo adoption and try that route or adopt a baby or something like that. And we have talked through that. My husband's pretty much like, we gave it a shot, like, let's be done. And
Mhm.
I'm okay with that because I honestly think, when you're doing it, you're like, yes, this will be my one chance. But then when you get to the end and it doesn't work, you do start thinking like, oh, well, maybe, well, what if we
Yeah,
just try
one
one more
more.
time?
Yeah.
Yeah. And I think you could do that for a long time. So yeah, I feel like I don't know why that was part of my journey or part of my story in life. I do feel, yeah, it sucks, but it
Yeah.
is what it is.
I do think though, like you said, there's a reason it was there. There's
Right.
a reason that
There's
it
always a
all
reason.
happened like it did. There's
Yes.
always is. And
Right.
yeah. Oh my gosh.
Yeah.
Well, I'm sorry you had to go through all that, but I
Right.
think even in that moment, those 2 weeks of hope and
Right.
excitement and possibility
Well,
was,
yeah. And that's why it was so, I mean, I don't want to say it was so hard because it would have been hard no matter when it happened. But because we knew for 6 months that we had a girl, that makes
yeah,
it feel more real.
right. Yeah,
We were picking out names and even buying stuff. I really was like, of course this is going to work. Like we've come
happening, of
this far.
course. It's already happened. It's just a
Right.
formality at this point.
Right, right. Yeah, exactly. So I kind of did feel like I was 6 months pregnant, in a
Yeah.
way,
Oh,
because it had
truly.
been real to me that whole time of waiting. Yeah,
And I think women, we all get so stuck in our comparisons. Like,
right.
well, at least you lost it early, or at least it was, but I mean,
It doesn't matter.
you can vouch for the minute you find out that this baby is here,
Right,
that this baby is your baby, it doesn't
right,
matter how long it is, it's still a loss.
right.
So what have you been doing, or what do you do to cope with your grief of that?
Yeah, it was really hard at first,
Hmm.
because, well, it would have been hard no matter what I do for a
Hmm.
living, right? But because I'm a doula, it was extra hard.
Oh,
Yeah,
yes.
hard wanting to have a baby and going to births and supporting people through that when that's not what you're having happen, when you're wanting that to is hard. And then supporting people who have done IVF. I can't tell you how many births I went to where my client was like, oh, we did a vasectomy reversal and it worked on the first time, or we did IVF and this was our only embryo. And I was just like, are you kidding me
Why
right
is
now?
this showing up for
Yeah.
me?
So that was really,
Hard.
and then, I would have to keep it together because I can't lose it at a birth when I'm trying to support somebody or in their prenatal visit or in their
Yeah.
interview when I'm a professional.
Was there
So,
ever a part of you that's like, I can't do this work
yeah,
anymore. This is not for
yeah,
me.
for sure.
Mm. What kept you going back to it?
Well, being a doula, you can't just quit. I have clients that are due over the next 6 to 7 months.
So it's not
I
like you can be like, I'm done. Yeah.
exactly. I have to give my notice very far out, unless there's a way around that. I could be like, listen, I'm not doulaing anymore. Let me find you somebody else and refund
Yeah.
you your money. But yeah, there was a time when I was like, I don't think I can do this anymore and I can't be around
Mhm.
this and I'm gonna
Yeah.
have to quit and like find
And that
something
would have
else
been
to do.
completely understandable.
Right. And then my husband, he was like, no, Sarah, this is what you're called to do and you're so good at it and everybody loves you. That was good to hear from him.
But I think too, you can bring this perspective into it. It's so valuable because you understand the preciousness of
Right.
life. Not that you didn't before, but you just have a new perspective of it.
I know a lot of people told me when we went through that, like, oh, but now you'll be so good at comforting people who have lost. I would get a little mad because I was like, okay, but that's never my client. Like maybe they have a history of loss, or maybe, yes, true, they could be experiencing a loss while I'm working with them, but they're all already pregnant and planning a birth. I'm not dealing with people who have an early loss. I'm not the one
Yeah.
guiding them through that. I'm there for the happy stuff, the
Yeah.
we're having a baby part. And yeah, we do sometimes have clients that have a loss anytime. We've had first trimester, second trimester, third trimester, and we've supported them through that. And it's horrible. I don't feel like I treat them much different now after my experience than I did before I went through it. But I also feel like maybe that's because my situation is kind of unique and it feels unique to me.
Mhm.
Be an embryo IVF loss just feels different.
It's a loss. It's the
Yeah,
loss of the dream of would have been.
for sure.
So with your clients that have had a loss, what do you think is the best support for them?
That's a good question. I do think it is helpful to, if you have a doula, let her be a part of your loss. So like I have been to births where people are birthing their
Yeah,
babies that have passed. I think that is very helpful to
I
the
bet.
patient. Sometimes they don't see it that way when people find out their baby has passed. It's so traumatic and shocking that they just can't make decisions. They're
Mm,
like decision fatigue. There's too many choices, there's too much stuff, but they're also going through all of that grief. And so sometimes I have to be, not that I'm ever forcing myself, but I kind of have to say, like, here's all your options. But like, if I'm recommend, like, I would really recommend, really highly consider, XYZ. So, and hoping that I do bereavement photography as well. I'm a
mm,
birth photographer, but I also do
love
photos
that.
for those people who have losses. I think just having that person on your side that's not that your doctor and it's not your nurse that you've never met, somebody that already at least a little bit can be there. And then we're there for the postpartum stuff because that's really hard. Chances are you're not going to go back and talk to your provider or the nurse.
No.
So I think having that consistent person that's been
Mm,
with you through the things is great. There are bereavement doulas and there are
mhm.
doulas that are specifically trained to help with people who are experiencing loss. People
Yeah.
don't often know that. You're not going to learn about that and then seek it out after you've found out this news.
Right. Where do you
Yeah,
look? That's the
right.
thing. Where do you look? Can you like
Yeah.
explain what is the difference between a doula and a midwife?
Yes. A midwife is trained medically to keep you and your baby safe. So that would be your care provider, just like you have an OBGYN. You could instead have a midwife. They deliver babies, they can do ultrasounds, blood work, medications, and all the normal things that someone would need for care. The only big difference is that an OBGYN is a surgeon and can do vacuums, forceps, and
Mm-hmm.
C-section.
Yeah.
Midwives don't do that part because they're not surgeons. So typically a midwife is going to appeal to people who want maybe less medical intervention or who are low risk. They usually have like a little more time to spend with you or a little more patient, those types of things. So they are in charge of keeping you and your baby healthy and safe. A doula is hired by the parents, and we are their emotional, physical, informational support and advocacy person. We are like a labor coach. We are not going to check their cervix or take their blood pressure or
Mhm.
do anything medical, but we are there for emotional support, childbirth education, position changes, pain coping tools, and advocacy. And we are hired when they're pregnant, work with them through pregnancy. We are at their labor and birth, and then also do usually a postpartum visit.
Nice. So you would hire a midwife would be either or probably with an OBGYN.
Right,
But then a doula wouldn't be instead of that. It would be in
correct.
addition to, and it
Right.
would be that
You're
would
gonna,
with you through the whole thing.
right. So you're picking your doula, you're choosing her to be with you. Yeah, you're
Hmm.
hiring her. If you fell in love with your childbirth educator, you could take
Yeah.
her to your birth with you. It's
Isn't
kind of
it
like that
nice? I know. It's so, I know.
everywhere. Yes, we go to home births and birth centers and hospital birth.
So you do it all,
Mhm.
anywhere they want to go.
Right.
That's where you are.
Yeah.
And are the hospitals receptive
Oh,
to
yeah.
doulas? Yeah,
They're pretty
nice.
common here. I know it's not like that in every state, but doulas are becoming much more
I think
common.
I'm in New York State, so I think they're a little more guarded here, but it's getting better.
Yeah,
Um,
it's definitely, it's a collaborative. I feel like most providers and nurses are happy to have a doula involved, and that can make
yeah,
their job a little bit easier in some
I would
aspects,
think with the understaffing that probably
right?
would be helpful. Have someone else on the ground with them.
Right.
So if someone were wanting to become a doula, how do you become a doula?
Yeah, there are a lot of different training organizations that train doulas. You could do anything from an in-person class
Mm,
to a weekend or 2 weekends, like full immersive class to an online only class. On my Instagram, I have a highlight that goes over the next steps if you want to be a doula or things to think about. First, you Google how to be a doula, and there will be the different organizations that pop up. And then you just want to pick one that kind of aligns with you and has the same kind of like
so is it like
values.
a certification?
Yes and no. You can take doula training. Certification is usually another step, but not always. It depends on who you're going through. It's not regulated. Doulas are not regulated. So technically, anyone could call themselves a doula and practice without any training, which is a little scary, but it's a thing. So you just want to make sure you are trained and that if you're
Yeah.
hiring a doula, you're hiring a trained doula,
What to look
right?
for if you're looking for a doula.
Right. So I
Yeah.
am certified with DONA. That stands for Doulas of North America. They
Mm.
are the premier, most well-known organization that has been around the longest. They set the standard, which is why I like to go through them. Some insurances will reimburse for doulas, and that's kind of becoming a thing. But I know being with DONA, whatever happens, I'll be fine. I won't have
Mm.
to recertify somewhere else. If you take an easy online course, that might not be recognized by an insurance someday. And
Yeah.
so then you
Yeah.
could run the
So if you're going to do
situation.
it, maybe go ahead and,
Yeah, I
yeah,
would.
do
But
something that's more recognized.
yeah,
I love that. So what's next for you, Sarah?
I'm just here being a full-time doula.
We
So
had to
busy.
reschedule this a few
I
times
know.
due to these babies coming just whenever they feel like it.
So true. I actually work with two other doulas right now. We've been working together for 5 years. I love it, my little collective we have. It's great. And I'm also mentoring new doulas who are taking training and then they're kind of like, what next?
Yeah, because it's one thing to take the training, but it's another thing to build.
A business.
How do you find clients or how do
Right.
you get out in your area? Because it's so dependent on where you live and connecting with the right people to get your name out there.
That's a lot of hard work. People are like, oh my
I-
gosh, I have to build a website and do all these business things. And also, where do I get my
Yes.
clients? And then what do I do? They feel scared, which is normal. It's
Yeah,
hard to
right. It's one thing to
learn
be
the things
passionate
and
about it, but then
you
do all
go
these
do
other
it.
things. Well, thank you so much for being here and sharing your story. I always feel like every loss has a different story, and it's always interesting to hear how it came to be, and it changes your life forever, no matter how
Yeah.
long they were with you. So thank you for sharing that and your
Oh, yeah.
expertise and what you do. I'm sure your clients are lucky to have you with them during their birth
Oh, thank
experience
you.
and every now and then the loss. I'm sure that's the thing about the birth world, isn't it? It's
Hmm.
not all just
No,
fun and holding babies.
right.
There's also things that come with it. So how can people look for you
Yeah.
and find out more about what you're doing?
Yeah. So my Instagram, which is also the same as my website, it's the expert doula. The Instagram handle is the dot expert dot doula.
Okay. All right. Yeah.
I'm also with the Birth Collective, PNW. So
Okay.
they can find me
Well,
in either spot.
I will for sure link those in all the show notes, and I appreciate you.
Yeah, I appreciate you too. Thank you.
Thanks.
All right, bye.